We are going to start learning forensic with the general aspect of forensic science. First of all, let's start with the topic of human organ transplantation. See this question, and after that you tell me which of the following specialist is not authorized for pronouncing brain death. See, this question is related to human organ transplantation. So now you tell me, out of these four, see, whenever you'll be working in hospital, for sure, if there will be brain death, or just after a road traffic accident, if you are getting completely unconscious patient, and you are seeing that patient is not responding to anything, even Glasgow Coma Scale is minimum, fine. Now the question is whether he is brain dead or not. Which doctor should go there and pronounce him as brain dead? Out of these four options, which should not be allowed? See, the patient who was under the treatment of a physician, yes, he can pronounce. Neurosurgeon, yes. Registered medical practitioner in charge of the hospital, RMP, yes. But who should not be allowed? Please understand that a doctor who belongs to organ transplantation department should not be allowed, should not be invited to pronounce a patient as brain dead. Question is, why? Suppose if I am a neurosurgeon, suppose if I have to do one kidney transplantation for one of my patients who is waiting for one kidney. He does not have any donor. Impatiently he is waiting for one kidney. Even I also want to save my patient. See, my patient will be my first priority. So what is happening here? My patient has already sent a requisition letter for one kidney. So whenever there will be a donor, please give me one kidney. Okay, fine. Now I am also waiting for a person who is going to be unconscious or who will be pronounced to be brain dead. At that time, I can harvest one kidney and I can save my patient. So don't you think being a doctor who belongs to organ transplantation department, I am selfish somewhat? I'm having some interest because for me, most important is my patient only. I want to save my patient. I don't want to save your patient because this is the matter of my patient. Because if I will do successful transplantation, if I will be able to make my patient survive, then I will become more famous. I will earn more money, right now. So even that unconscious person is not brain dead because of my selfish interest, I can declare him as brain dead. So I should not be invited to pronounce an unconscious person as brain dead. Out of these four, who should not be allowed, who should not be invited? Any doctor from organ transplantation department, either from liver transplantation or the kidney transplantation or whatever transplantation. I hope this is clear to all of you. So the question is that which doctor should be invited to pronounce a patient as brain dead? There is always a medical team. There is always a committee board. Ideally, there should be a neurophysician or neurosurgeon. But if neurophysician or neurosurgeon is not available, then RMP, registered medical practitioner, in charge of the same hospital where patient is admitted. Even the doctor who is seeing the patient or any kind of a specialist doctor, anyone can be invited, any specialist can be invited to declare a person as brain dead except the doctor who belongs to organ transplantation department. Now, question is, in which condition you are going to get the authorization? First of all, please understand that who can donate the organ. See, like there can be living donor and there can be a cadaveric donor. A person who is alive and he is donating his organ or any part of the body. Suppose if a person who is having liver cirrhosis and liver transplantation is mandatory for him. This is the only choice, liver transplantation. So this patient is going to get some part of the liver from his own brother. When brother is going to donate him a part of liver, this is called as living donor. Living donor. Or a patient of blood cancer is there. A patient of blood cancer is there. Who wants bone marrow for sure? So for bone marrow transplantation, he is going to get from his own brother or own sister. Fine. So the donor will be considered as living donor. But when I talk about liver transplantation, liver can be harvested from a living person also or from a dead person also. So one is living donor, another is what? Cadaveric donor. So now the question is that who are considered to be living donor? First is a near relative donor, and second is a non-related donor. See here, a near relative donor means what? Means like own spouse, own kids, or the grandchildren, siblings, or either the parents and the grandparents. So whenever there is a near relative, consent or the permission will be taken from the doctor